here at Renovus Medical Spa talking with Pam Davis, a physician's assistant here at the spa. Pam, thank you so much for joining us.
Well, thanks for having us.
Yes. So we are talking about a procedure that you all offer here at Renovus. It's called Thermiva. Tell me a little bit about it.
Our Thermiva is our radio frequency machine, and it helps women for vaginal rejuvenation. So it's a non-invasive, it's non-ablative, and it heats up the tissue, and it helps the tissue become more vibrant again after women have gone through, maybe they've had multiple births or they've gone through menopause. Women who can't take any kind of bioidentical hormones, things like that. So they have a lot of vaginal changes.
Right.
So the radio frequency machine heats up the tissue. That causes the blood flow to increase. When the blood flow increases, then you get what's called fibroblasts, and that increases collagen. And collagen, as we know, is our elasticity.
Right.
And so women lose that elasticity.
And so you mentioned that what you use, it heats up. And we want to make sure that our viewers know that the heat is just minimal heat, right?
Right.
It's nothing that is painful or anything
No,
like that.
no. There's no burning. There's nothing of the tissue. You don't even see anything really. The tissue might get pink just because you're bringing blood flow into that area. But it's just a warm sensation.
Right. And so you mentioned the ideal patient maybe is someone who can't take hormones or multiple births. How do people know if maybe this is the right procedure for them?
I would say any woman who is having any difficulty in that area, so maybe they have had, maybe there's cancer in their family and they're concerned and they don't think they're a candidate for any type of bioidentical hormones, which is what we would recommend because those are the natural hormones. But a lot of doctors would say those patients aren't candidates, so they're going to have problems. This would be a wonderful solution for them. So if maybe you're older and again, you're not a candidate, again, for any type of oral treatment, then this would be a great treatment. We have a lot of women who get recurrent infections or maybe they have stress incontinence, so you can't bounce on the trampoline with your grandchild
or pick them up or anything like that.
Or coughing or sneezing, so you get leakage. They would be a wonderful candidate for that.
And so the actual procedure only takes about 20 minutes, you said, right?
Yes.
And any downtime?
No, there's no downtime. So you leave here and you just go do whatever you want to do.
Wow. And so people have 3 procedures, right, over a couple months. Tell me a little bit about that.
So we recommend 3 treatments, and we recommend a month apart. And then after you have your 3 treatments, women see, actually after the very first treatment, women come back and go, I noticed a great difference. I can see an improvement. Whether that is just that they don't feel like they're leaking as much as before, or maybe they have more moisture and they feel like, okay, it feels a little bit better, or infections have gone down.
Right. So really the reaction from your patients after getting this procedure done has been very well, huh?
Yes, it's very well received. They've done very well. Dr. Clements did the original FDA study here.
So you guys have been doing this procedure for quite a long time, so people can feel very comfortable when coming here, right?
Yes, yes. And we have it in our beautiful room here because we want it to be a little more intimate and a little more spa feeling than medical.
Right. Well, and I think something too that we talked about is confidentiality, which is so great, especially for such an intimate procedure like this. People can come in here, feel calm and relax, and really you can kind of put them at ease with that too, right?
Yes, we do try to make everyone feel very comfortable.
Wonderful. Well, Pam, thank you so much. We so appreciate it.